My name is Lily Money. I'm giving my informative speech over the effects of smoking on your body. Think of 10 people that you know that smoke. Now pick which one you want to have lung cancer, and the other 9 will be affected by some other sort of smoking-related disease. 1 in 10 chronic smokers is killed by lung cancer, according to QuitYourSmokingAddiction.com. Smoking affects the whole body, not just the lungs. People always think of the lungs, but toxins travel throughout your whole body, leaving a trail of damage. The most common place is the lungs. Lungs are protected by a thin layer of mucus. When you smoke, this mucus goes into overproduction mode, and you have too much of it in your lungs. The lungs are cleaned out by small cilia that are hair-like substances, and they sweep away the toxins and the extra mucuses. But when you smoke, these are paralyzed. So it's not able to clean out the mucus or the toxins that come in your lungs. There is also damage to lung tissue, which decreases the lung surface area, which also decreases the amount of oxygen that can be carried throughout your body. Smoking can cause chronic obstructive pulmonary disease, COPD, which is a disease in the lungs that makes you feel like it's hard to breathe and will eventually make you feel like you're drowning. It's eventually fatal. 80% of deaths from COPD are related to smoking, and you have a 10 times greater risk of death when you smoke from COPD than if you didn't. Lung cancer is the most common disease thought of when people think of diseases from smoking. There are 60 known cancer-causing chemicals in cigarettes. These chemicals change the pre-cancer cells into cancer cells. 85% of lung cancer cases are due to smoking, and lung cancer is the leading cause of cancer death in the United States. Although it does damage to the lungs, there are a couple other places that it does damage to. Smoking does damage to the cardiovascular system. The nicotine found in cigarettes causes the arteries to restrict, which reduces the blood flow throughout your entire body. Smoking also lowers good cholesterol levels and raises your blood pressure. This causes a fatty buildup of bad cholesterol in your arteries. There is also a higher risk for blood clots when you smoke, which increases your risk of stroke. Okay. These are some visual aids for what smoking does to your body internally. This is a healthy lung. It's nice and clean and white, and this is a smoker's lung. It's black, and it has a decreased surface area, which means it's not able to carry oxygen throughout your entire body, and it wasn't able to clean out all the toxins because the small hair-like features called cilia were paralyzed. So you can see the difference. And then this is arteries. This is a normal artery. You can see the blood can flow clearly through here. There's no restrictions. And this is a clogged artery. It has a fatty buildup of bad cholesterol, which is the yellow. And then there's a blood clot, which is right here. This is what smoking can do to your arteries, and this is what they would look like if you didn't smoke. Since these are internal, there are also some external damages that smoking can do. They can also do damage to your appearance. One of the most common damages to your appearance that smoking does is it damages your mouth. It stains your teeth yellow, and it causes gum disease. This can cause your teeth to fall out, so overall your mouth isn't going to look as good as it was if you didn't smoke. It also does damage to your skin. It causes it to lose its elasticity and some of the properties that keep it from wrinkling. There's premature aging of the skin and more wrinkles when you smoke. Smoking is also related to hair loss. This right here is a non-smoker's mouth. It's white and clear, and it has all of its teeth. This is a smoker's mouth. You can see the teeth are yellow, and some of them are missing, and it looks a lot worse than a non-smoker's mouth. So overall, you can see that smoking does damage to all parts of your body, not just internal. Even if you aren't seeing any symptoms from smoking, some of them may not show up because they're internal, but it does do damage to your external appearance too. Harlan Brundtland, director of WHO, said, "Cigarettes are a euphemism for a cleverly crafted product that delivers nicotine in just the right amounts to keep the user hooked for life before killing the person." Thank you.